Library Card Productions. I'm here at Terrificon with Treasure Time, an amazing organization. They're here at the con raising awareness and support, and, well, I'll let them talk about it because they're the experts.
So I'm Suzanne Major, founder and CEO of Treasure Time, and our mission is to grant the wishes of parents who have life-threatening illnesses, and we help them to create a memory with their children. So it's kind of like Make-A-Wish, but we're for the parents who are sick.
So 2 years ago I had Hodgkin's lymphoma, and when I finished up chemo, Treasure Time sent me and the kids and my husband to Great Wolf Lodge for the weekend, and it was perfect. I mean, the kids, when your mom is sick, the kids are kind of lost. And it was a nice little, way for us to kind of regroup as a family and just let the kids be kids for a few minutes and not worry about me. And I got to watch them be kids for a few minutes. And I mean, there's nothing like it. And I love Suzanne for it. And so yeah, now I'm healthy, and my kids and I, we volunteer every chance we get, and coming to the con was a big event. The kids can have fun, and now, we're spreading awareness further than the Valley, which is where we are out of.
And they are amazing. They make me feel like they are family, and they are genuine. They really care about you. It's okay, it's beautiful, the vacation and all the stuff, but the most touching and beautiful part is how they embrace you. And when they call us and they say, you want to go to Terrificon, I say, yeah, why not? Even this opportunity we are having right now, we are celebrating my 11-year-old daughter's birthday. For us, it's like amazing. It's like, it's so lucky we are here. And thanks to Treasure Times and Terrificon, they agreed to granted us to be here, and we are so happy.
We are funded all by donations, and so something like this is great because we can get our name out there and help people understand how important what we do is.
And I'm really glad that we had this platform at something as huge as Terrificon to be able to spread the word to people who are maybe looking for an opportunity to give back and wouldn't necessarily expect an opportunity to give back at a place like a Comic-Con, and they show up at Terrificon and boom, yay, they can give back.
All of the celebrities were just beyond excited to help us, gave us autographed pictures that we could then raffle off at our events. It's just been unbelievable to support. And actually one of the people that we're here in front of, Neil Adams, that he would be thrilled to donate some stuff to Treasure Time to help us raise funds. So we're over here today and we're going to pick that up from Neil.
That's really great. Well, as you can see, Terrificon is bringing people together and doing things for the community, which is fabulous. Thank you so much, ladies. And
go on our website, treasuredtime.org. Make a donation. Whether it's $1, $5, $10, we'll take it. It just goes to build a memory for a family that those children will never forget. Thank you.
Push to close the breast cancer gap. Women of certain ethnicities have a higher risk of bad outcomes. So now, medical professionals are trying to change that.
African American and Latina women are the most affected by this. News 8 medical reporter Jocelyn Memento shows us what's being done to increase survival rates. In general, breast cancer specialists say certain ethnic groups, African Americans, Latinas, do not do as well compared to Caucasian women. Now there's a push to gather more research, like finding out what drugs work best for them to better level the playing field. Targeting inner-city women from different ethnic backgrounds. Women like Maria Castellani and Wendy Ormond to sign up for clinical trials.
They don't do as well, no matter what stage they are diagnosed.
Is the mission of breast cancer specialist Dr. Andrea Silber at Smilo Cancer Hospital at Yale New Haven.
Part of that, I think, is because we need to learn more information about what are the best drugs, what's the best way to level the playing field.
The first step, educating more women like Maria.
I was the kind of person always was too busy taking care of kids, working.
And Wendy.
I didn't even go to the doctor. I was bad. I'm not going to lie. And then I found that lump.
To put themselves first when it comes to their health. Both are working moms with breast cancer. Both are now on novel drugs only available to them in clinical studies.
Don't be afraid. Don't be afraid of it. Go and do what you need to do.
Maybe it's not for my own benefit right now, but who knows? Maybe gonna help my little ones or another women who really gonna need this medicine.
Key to improving the survival rate, bridging the language and cultural gap between doctor and patient.
Everything that I understand, Wendy needs to understand to make informed decisions. And anyone can make informed decisions. It's just a matter of communicating with your patients.
I was scared of doctors, but you shouldn't have to be afraid of doctors. You should face it.
Faith and a good doctor make wonders.
Both Wendy and Maria are battling their own unique but challenging breast cancers. Dr. Silber says they are responding well to their cancer drugs. For more information on breast cancer trials underway, log on to WTNH.com. Back to you.
We've long known that DNA determines much of who we are and what we look like. But did you know scientists are now manipulating an individual's unique genetic blueprint to make cancer therapies even more effective? It's the cutting edge of cancer.
Sometimes those little shorebirds are hard to spot.
Bob Carlson thought he would spend many relaxing years indulging in his favorite hobby,
you're a copycat mockingbird,
bird watching. But at age 68, he was told he was going to die.
We both thought, because it was stage 4 lung cancer, that this was going to be it. This was the end.
His traditional treatment, 16 months of chemotherapy, was debilitating and painful.
My mouth was bleeding and my nose was bleeding. I was nauseous. I had no strength. Didn't want to get out of my own way.
So when Bob came to see me, he had had multiple rounds of chemotherapy and his cancer was still growing. He was really out of options.
Bob signed on to a clinical trial headed by Dr. Roy Herbst at Yale's Smilow Cancer Center, one of hundreds of trials across the country, testing one of the newest weapons against cancer, targeted therapy, a treatment specifically focused on a gene that affects how cancer cells grow. Everyone knows about chemotherapy and radiation and how debilitating that is. So how does targeted therapy play into that?
And one of the best things about targeted therapy is cancer treatment is so hard because with the chemo, with the radiation, we wipe out the good and we wipe out the bad. But targeted cancer therapy, we're able to specifically focus in on a genetic mutation that's just in the cancer cell, leaving normal cells largely alone. So with this targeted treatment, people have few to no side effects.
In Bob's case, doctors identified a protein called PDL1, which was preventing his immune system from fighting the cancer. By targeting and disabling just that protein, they cleared the way for his own immune system to attack the lung cancer.
He was able to get on the study, and within weeks, we started to see his tumor shrink. That's more than 3 years ago.
Want to take a look at your films? Sure, why not?
Even more important than that, his side effect profile was relatively mild. He has a good quality of life.
And Bob is not the only one defying odds with targeted therapy. Maria Castellani's breast cancer was so advanced, a large tumor had grown on her neck.
It wasn't just in my neck, because I had several metastases in my lungs too.
She sought out a clinical trial here at Yale University, headed up by Dr. Pat LaRusso. Dr. LaRusso's team decoded Maria's genetic code and found specific genes that helped her cancer cells to replicate. They targeted those genes with a drug combination that attacked a part of her DNA, the DNA that caused the replication of Maria's cancer cells.
We saw a response in Maria's neck within a week. It was amazing. The disease just shrunk in front of our eyes because we could visualize it and see it. The tumor's shrinking.
Currently, while many of these targeted therapies extend life with little side effects for people like Maria, no one knows how long they will work, and typically the cancer eventually learns how to circumvent the treatment.
I fear that Maria will eventually not respond any longer to this treatment. That's what typically happens. But for this moment, we've been able to celebrate life together.
And for Maria, the gift of more years with her young girls and the knowledge that she is part of something that will eventually help other cancer sufferers gives a sense of purpose to her journey and something else.
Tears of happiness is not a sadness. Yeah.
I don't know if I will see the majority of cancers cured in my lifetime, but I do know that we're transforming an acute disease into a chronic one.
And for Bob Carlson and his wife Julie, every day they hike together to watch their birds, it's a victory against cancer and a sign that many more hopeful targeted treatments against the disease will soon take flight.